Over 100 people gathered at Hudson County Community College on Sunday afternoon to listen to John Wisniewski, a Democratic Assemblyman from Middlesex County and a 2017 gubernatorial candidate, share his plans on protecting the citizens of New Jersey from the health care coverage that he considers a nationwide crisis of uncertainty.
So our immediate threat today, health care coverage for New Jerseyans face a statewide, a nationwide crisis of uncertainty. And that crisis of uncertainty threatens our health and our economic future. That crisis of uncertainty has a name. It has a name. Donald Trump. Republicans in Congress started on their plans to repeal the Affordable Care Act. Now, the bill wasn't an exact bill that addressed the Affordable Care Act. It was one of those legislative arcane maneuvers, but it set the stage for Republicans in Washington to repeal the Affordable Care Act. If they outright repeal the Affordable Care Act, here's what we know, here's what is certain about what will happen. In New Jersey, 400,000 people have coverage directly from the marketplace instead of from an employer. Those 400,000 folks are immediately out in the cold, have no coverage. 43,000 qualified for expanded Medicaid. They will likely lose their coverage as well. But let's talk about how it impacts people, our friends, our neighbors. You know, the numbers I gave you are statistics, but behind those statistics are actual living, breathing people who have real-life issues and concerns every single day. Let's take the expectant mother. She's going to deliver in June. She doesn't know what kind of health care coverage she'll have when that baby comes. What about the young men and women who are in college and have relied on the fact that they can stay on their parents' health care? Health care is not an option. It's a basic human right. The Trump administration plans for the Affordable Care Act, as I said, aren't clearly known. But we do know that they have their ideologues in Washington who are really concerned about insurance company profits. But they really fantasize about privatizing Medicare. Think about that. A program that works. One of the programs actually, you know, you can criticize government a lot for a lot of things that don't work well. Medicare actually works pretty well. It's really just another Wall Street scheme for profits at the expense of people. So the next governor of New Jersey is going to potentially face a catastrophe in our healthcare system. And that's something that our current governor isn't even addressing. For those of you who watched the State of the State address earlier last week, the governor talked about the opioid crisis.
He also pointed out New Jersey Governor Chris Christie's State of the State address on the opioid crisis. During the governor's address, he mentioned that people would be able to receive treatment for this disease. However, Wisniewski reminded the public that Christie failed to address what happens to this program if the Affordable Care Act is repealed.
I've lived in this state my entire life. New Jersey is a great place. It has great resources, it has great schools, and it has great people. We need to worry about the people in the state of New Jersey. As a father of 3 girls, as a small businessman with 8 employees, as a candidate for governor, and as your next governor, I am going to do everything in my power to head off this crisis and work towards a single-payer system right here in New Jersey.
As far as the high cost of prescription drugs, U.S. Senators Bob Menendez and Cory Booker also received criticism for voting against bringing in cheaper prescription drugs into the United States that had the same quality and effectiveness of domestic drugs.
As governor of New Jersey, one of the first things that I will do is sit down with the CEOs of those companies and say, you're here in New Jersey. You're benefiting from our great workforce, our great school system, our higher education system. Well, you need to give us a break on prescription medicines. It can't all be about profits. As governor, I propose to create a Medicare for all system so that people in New Jersey, once and for all, regardless of what happens on a national level, will no longer have to continue to wonder about where their future in health care lies. But with the powerful special interests that are concerned about this issue, who have access to lobbyists, who can put more money into this issue than you can, the task ahead of us is formidable. I know already that my opponents will take shots at me about the things that I'm saying to you today, but I don't care, because this is a fight that together we can win.
Hudson County View, the eye of the community.